Dr. Ali, and I'd like to welcome you today. We know that when we improve our health, we improve the quality of our life. And our goal for you is to bring you the knowledge and resources that you need to empower yourself, your family, and your community. If you're joining us for the first time, make sure that you subscribe so you can make informed changes to improve your mind and body. With that, let's talk about something very interesting. The topic for today is called psychobiotics. So, when we talk about mental health, we may not know that psychobiotics is a new concept in the field of mental health. And we will see how psychobiotics are actually used as a novel approach to address anxiety and depression. We will talk about the connection between the gut and the brain, and we will also discuss how psychobiotics also affect other organ systems in the body. So let's talk about psychobiotics. So now, what are psychobiotics? Psychobiotics is a term that's used by researchers to refer to certain bacteria inside our digestive tract. And these bacteria play a very important role in our mental health. So this is an emerging trend whereby we now know that we can actually change the bacteria in our gut, resulting in our mood getting better and our anxiety getting better and our depression improving. So this is very exciting to know that we have a different way of addressing mental health. So when we talk about anxiety and depression, let's first talk about how is it that we experience anxiety and depression, what really happens. So what happens is that we have chemical messengers in our brain that are called neurotransmitters. And any kind of brain dysfunction and mental health is related to an imbalance of these neurotransmitters. We know that serotonin is one of the most important chemical messenger, which plays a very important role in depression and anxiety. Medications that are used for depression and anxiety actually try to increase serotonin in our brain. But did you know that 90% of serotonin is actually produced in our gut? Which means that it is not really the neurotransmitters or chemical messengers in the brain that influence the brain, but actually these are neurotransmitters in the digestive tract that influence the brain. And serotonin is not the only chemical messengers that is made inside the digestive tract. We also make GABA, we also make acetylcholine, and we also make dopamine. So this is really important to understand because the question then becomes, how can we make sure that our digestive tract makes more of these chemical messengers? Because if we can do that, then we can improve our mental health. So that is where the role of the gut-brain connection comes. So our digestive tract is called the second brain. It is called the second brain because it produces a lot of the same chemical messengers that are produced in the brain. And it has a very strong hold on the brain, which is the reason why we feel that a lot of people who have mental health issues might have those problems because they may actually have gut issues, which means that if you have irritable bowel syndrome or other symptoms related to the gut, you are going to have issues with anxiety and depression and focus, brain fog, concentration, so on and so forth. So instead of trying to fix the brain, maybe we should try to fix the root cause of why the brain is not functioning. So when we look at psychobiotics, we know that psychobiotics are bacteria, which if we take those, then they can change the type of bacteria inside our gut that can lead to making more of the chemical messengers that will lead to better brain health and better mental health. So in 2022, a study was performed which showed that a high dose of probiotic with 8 different strains of bacteria led to a decrease in symptoms of depression. So clearly, we are getting more and more evidence of how these psychobiotics can play a very important role in mental health. Now, it is not just mental health that is affected by psychobiotics. They play a very important role in other areas too. So, for example, we know that psychobiotics significantly improve digestion because now we have good bacteria in our gut, and so we will have less symptoms of irritable bowel syndrome. The second thing we know is that they improve immune health. Most of our immune system is located in our digestive tract. So psychobiotics actually improve our immune system. Third, and very importantly, we know that they reduce the risk of heart disease and they reduce the risk of cognitive diseases such as dementia. So we know that psychobiotics or probiotics can really help us in many different ways. How do we incorporate these psychobiotics? So there are certain prebiotic foods. Prebiotic foods are foods which are foods for the good bacteria. When the good bacteria consume these prebiotic foods, they reproduce and we get more of these good bacteria. We get healthier populations of good bacteria. And these bacteria then go on to produce those great and amazing neurotransmitters that we need for our brain health and our mental health. The second thing we can do is to look at probiotic supplements. So the supplements can also provide the good bacteria. The third and very important area where psychobiotics help is by producing so-called postbiotics. So what are postbiotics? So what happens is that when we get good bacteria inside our gut, those good bacteria release certain substances. And those substances are called postbiotics. A very important example of postbiotic is butyrate. So we know that butyrate is produced by good gut bacteria. And this butyrate has been shown in research studies to reduce hyperactivity. It's shown to reduce depression, and it's shown to reduce manic-like behaviors. We also know that butyrate can help heal leaky gut. It can prevent colon cancer, and it plays a very important role in cognitive health and degenerative diseases of the brain like Alzheimer's disease and Parkinson's disease. So now we know that if we can consume psychobiotics, they will lead to the production of butyrate or postbiotics. And those postbiotics will be very beneficial to our health as well. So are there any potential risks to consuming these? So psychobiotics really have minimal risks. And they can have, for example, some allergy issues, and safety issues will only be encountered in people who actually are severely immunosuppressed. Thank you so much. And for more information on how to treat your mental health using an alternative integrative approach using psychobiotics, you can connect with your functional physician. Thank you.